Hi, Faith. I'm David. I'll be your hypnotist and coach throughout this session.
Hi.
So tell me, what brings you to see me today?
I have had a recurring yeast infections.
Recurring yeast infections. Okay.
Yes.
That can be pretty annoying and somewhat painful.
Yes.
Tell me more. How long has this been going on for you?
Since I was about 14, 15.
14 or 15 years old.
Mm-hmm.
And have you been to see a doctor?
I have. I started out obviously with my family doctor.
Mm-hmm.
And your typical over-the-counter, and then prescription,
Right.
obviously.
And how those, obviously you're here because obviously those didn't work out exactly the way you'd hoped, so what's the story there?
I just feel like they're masking the symptom. They're
Masking
not
the
really getting
Okay.
rid of it because it keeps happening.
Right.
So.
Right. Well, it's interesting that you say that because the truth of the matter is that when it comes to things like yeast infections, and I've said this to other patients as well, is a lot of people who suffer from chronic yeast infections, the doctors will tell you it's a diet, or they'll tell you it's a lifestyle, or being too acidic, or whatever. Well, there's hundreds of thousands of people all over the world who have the same exact diet, who have the same exact body condition, but they're not having yeast infections.
Mm-hmm.
So what's actually going on that's causing this particular type of a condition to manifest? And that's the domain of a hypnotherapist. One of the things that we can do as a hypnotist or hypnotherapist is that we can actually talk to what I like to call the boss. That's your unconscious mind. Okay. Usually at the root of chronic recurring conditions like yeast infections, there's usually an emotional case or an emotional cause. There are three ways as a hypnotist that we can address recurring symptoms like a yeast infection. But in order to know which way to go, I need to know a little bit more about your particular case, because everything I do is tailored specifically to what works best for you. So the first question I have to ask is, at the time that these yeast infections started, what was going on in your life? You're 14, 15 years old, all of a sudden, out of nowhere, a yeast infection.
No, actually, I became very ill.
Became very ill? Okay.
For about 6 weeks.
What were you sick with?
They said it was a viral infection.
Okay.
But they think now, I talked to a family doctor recently, and he said it sounds like I probably had mono.
Ah, okay.
Of course, they put me on erythromycin for quite a while, and that's when it started.
And it just started as soon as you started the treatments for erythromycin, or did it afterwards? How did it manifest for you? I
don't remember. I think during the treatment.
During the actual treatment?
Yeah.
Okay. And have you noticed that how often did they come back after that?
Probably almost every month.
Every month?
Around my cycle.
Right around your cycle.
Mm-hmm.
Okay. And have you noticed anything that seems to make it actually worse?
Probably my stress level.
Stress level. Okay.
When I'm very stressed out and
exactly.
I know.
And how about have there been times in your life or things you've done that have actually made it feel better?
I have tried taking the live acidophilus.
Acidophilus, okay.
Yeah, you can get it at Henry's over the counter.
Good, good. And so you obviously didn't just, flip open the yellow pages and decide to see a hypnotist today. What made you decide that you wanted to come see me and talk to me about this?
An alternative route. I've been looking more into the natural healing, and I also have heard that you guys can help people stop smoking and